Well, I'm pleased to join my colleagues on the Senate Finance Committee in the advocacy that the insurance industry has to be part of our solution. I'm reminded what Harry Truman said when he said we should resolve now that the health of the nation is a national concern and that the health of all of its citizens deserves the help of all of the nation. Truman understood the meaning of community, that we have an obligation to each other to be part of the solution. And that means patients and doctors, healthcare providers, pharmaceutical companies, and most assuredly, insurance companies. All of us are willing and ready to come to the table. Hospitals have stepped up. The pharmaceutical industry has stepped up, and it's time for the insurers to step up and be part of the solution. You know, when we started this process, and I got a real clear sense from President Obama visiting the Democratic caucus several months ago, and from our own work with Senator Baucus and others, that we were serious about health care reform, I conducted a series of listening tours in my home state of New Jersey about this issue. And what was amazing to me is, of course, not the large number of New Jerseyans, 1.3 million, who have no health insurance whatsoever, but the many who had health insurance already, whether through their employment and or through their purchase of it, and who told me the stories of how much their co-pays were rising or their contributions towards that insurance was increasing, taking more and more of their disposable income out of their pockets to try to keep health care for their families. And how many times, even though they followed every step of what their policy said they needed to do in terms of getting reimbursement for a medical service that they needed, they were denied. And the frustration of going through those appeals. But those appeals, at the end of the day, has an industry making these record profits, because if you can delay people from being able to get their health care coverage that they need, and you dissuade people by going through an arduous appeals process that ultimately they won't pursue it, then you will save a lot of money at the end of the day, and that money goes to profits. Well, an industry that has had record profits, and I don't think any one of us has a problem with profits. The question is, how is that profit achieved at the end of the day? It is achieved in such a way that not only are there record profits, but are on the backs of American families across this country. And so it seems to me that as those profits continue to increase, as prices continue to rise out of the reach of most Americans, the cost of buying health care on the open market has climbed to record levels. At the rate that we're going, 1 out of every $3 a New Jersey family would be eaten up by their insurance costs. So what we're here today to simply say is that, in fact, the healthcare industry, a key component to comprehensive reform, has an obligation to come forward and be part of the solution. With their profits rising by the billions, insurers more than doubled premiums, while wages only raised 29% between 1999 and 2007. So you've doubled the premiums, but wages are nowhere near those increases. So it's clear and disturbing that private insurance have used their market power that they have gained to boost their bottom line, regardless of the cost to families. It seems to me that that simply says that that market power that you've used in a disproportionate way that has created record profits under a system in which you denied people, seems to me you have to be part of the solution now, especially when we are talking about, as Senator Schumer said, bringing 40 million more insureds into the process, for which you are going to get a large part of that opportunity. You need to be part of the solution. And finally, I do believe that as part of this process, to ensure that not only do the insurance companies participate, but that they are more responsive to their policy holders, that the public option is an incredibly important one to drive competition. And it is that, an option. I just had a series of business people in my office, and I'll end on this note. And from the disinformation of what they had to when I explained to them what a public option was, that in fact the insurance that they provide would continue to be the coverage for their employees should those employees continue to want to keep it. So if you like what you have, you get to keep it. If you don't like it or you don't have it, then you get to go into the exchange, and that exchange is a series of private companies. The ones that we want to participate are going to get 40 million more participants, which means it's going to drive up their profits, which means they need to be part of this process, but also to have a public option that can create the real competition competition so that they act in a way that not only provides health care coverage for all Americans, but does so in a way that they aren't constantly denied. And it improves the nature of the delivery system to each and every American. That's what all of this does, and that's why I'm proud to join my colleagues in this effort.
We're ready for your questions.
Senator Schumer?
Well, let's